So what drives us? What a perfect segue into our next part of our program called Continuing with the Way Forward. And we are going to take this next hour to hear from our panelists. I'm going to pose a question or two to the panelists and then to the larger audience so that we can hear from you all as well about what we're calling generally the way forward. And someone said I could do my own slides, and they're right. I just want to start before we've had a much reference to the Global Status Report on Violence that just was released by World Health and Organization and others. And within their strategies to reduce violence, I put together this slide because I think it speaks a lot to the areas that we've gone over in just this day and a half. Reduce availability and harmful use of alcohol, reduce availability of guns and knives, promote gender equality, and specifically to prevent violence against women and girls, and changing cultural and social norms those that support violence. Other things that are there in the report that I think are relevant to even just discussion now is also looking at the critical importance of safe and stable nurturing environments for children, for families, for building that sense of connection. What we were reminded, Fran brought to us, is finding and building the human connection. And they also talk about ensuring that we have programs that not only identify victims or help victims to come forward, but to provide services and care and support. So all of these things I think are certainly strategies that we've talked about in this day and a half. And I wanted to put that slide up there as we begin our conversation, which I'm going to start with a question. I'm going to come back over here if it's okay. It's easier. To Shelley and Bridget and to Elizabeth, who's in our long panel there. As FAR members, and then again we will put thoughts out to the larger group. Thinking over this day and a half, and you can reframe this question as it speaks to you, but thinking about what have you learned over these past 2 days that you could take back, or you're thinking of taking back to your own practice, to your own work, how it might inform your work?
There are some obvious things where I'm going to take specific things people presented and incorporate them in classes and share them with practitioners. But I think the thing that I learned and had reinforced here, a need that I will work hard to address. I also experienced in the previous workshop here regarding violence and mental health, and that is how little we as professionals know about each other's professional culture. We don't teach social workers about the police. We don't teach medical doctors about the culture of the police. We don't teach police about the culture of research. And so we come together and we say some pretty important things without really knowing each other's culture. I learned a lot from Steve about emergency medicine here. It's something I probably should have learned about 30 years ago as a young buck in law enforcement. And I think there's a need for cross-cultural awareness at the point of entry into our various professions. The same thing's true with community leaders. Community leaders need to know about the culture of policing, why things work and why things don't, what things can happen and what things can, and vice versa. Police need to understand, social services people need to understand, researchers need to understand the limitations on community leaders. So that was pretty profound, and it followed out into some of the breaks and some of the meals. Another thing that struck me, and I alluded to it here, as we talked for the last day and a half, and we talked about the needs, we talked about the issues we were addressing, we didn't talk much about what a viable, sustainable neighborhood or community looks like. What's the picture we're supposed to be working toward? We can get a lot more done if we have this vision of what the end product is supposed to be. And not many of our speakers addressed it in tangible terms. If I don't have a picture of what I'm working toward tangibly, what the positive outcome could be, and I'll come right back to that, then I'm more focused on process than purpose. And we talked a lot over the last day and a half about process. And so I've come away, I've talked to a lot of people during the breaks about those things, and I've gained a great deal of input and energy around those things.
So as any of you on the forum know, I am here because I work at Kaiser Permanente, so a large healthcare plan that cares for 9.2 million members and is in 7, 8, 9 different regions of the United States. So this morning, I said to Shelley, so what are you going to say? What are you going to talk about? And he said, I'm going to talk about how I'm taking some of these learnings back to my practice. And I realized I had been forming much larger, more grandiose ideas of what I was taking away from this workshop, and that maybe it would be helpful to actually bring it down to how do I see myself as an individual, as a clinician, and then also as a leader in a large healthcare plan. How do I plan to bring these messages back? Because I think that's part of the way forward. It's a challenge to everyone who attends these workshops, both to hold that larger picture. What are we as a collective group, a group of scientists, a group of multidisciplinary folks that care about this? How do we take this forward? But then also, how do we take it home? And so I thought I would mention some of the ways in which I intend to take what I learned from this workshop back to what I do every day. And one of them is thinking about how in every way that as a clinician I interact with a patient, whether it's a child or their parents or a teen or an adult, that I'm going to include what I've learned here and had reinforced again about firearm violence into my messaging about this as a healthcare issue. So that when we're doing anticipatory guidance for children and we're talking about car seats, we're talking about seat belts, we're talking about the value of breastfeeding, I will be talking to those parents about the dangers of having a gun in the home and about safety measures to keep their children safe. When I'm seeing a teen in clinic, I'm going to be talking about alcohol and other drugs and their misuse and the vulnerabilities that that can cause, as well as the association with violence and with firearms. I'm going to be talking with them about depression, about suicidality. When I talk to adults, I'm going to be thinking about the adult men I see as what I've learned here from the epidemiology in a very different way when I talk with them about whether there are firearms in the home. I'm accustomed to talking to women, and particularly screening around IPV and asking about things that would increase the level of danger in the home. And I speak about guns in that context. But here's an additional population that I really want to be aware of and reaching out to. So those are some kind of easy areas in which I as a clinician can make a difference. Then I as a colleague to my mental health friends, I think we need to really make access and treatment to substance misuse something that is really available and is talked about in the primary care setting, because most people won't come to specialty mental health care. And that's again a venue, and all of us have venues like that where we can bring forward the importance of those kinds of treatment opportunities. And then finally, as a person who works in a large healthcare organization, how do we leverage what healthcare can bring to the assets in a community? I've been living through watching us attack the obesity epidemic, and we've moved from talking about what we want to prevent to also what we want to promote. We want to promote healthy eating, active living, heal. That fits with the medical and health professional goal. And what I would like to suggest is that we talk about healers, healthy eating, active living, and enriched relationships, because so much of what we've heard about today is the critical importance of connections, of naming the people who have made a difference, of having them here at the table as partners, and then in thinking about what the assets are in a community that can help promote safety and prevent gun violence.
Elizabeth, as a presenter who looked at community-based intervention, I wonder if you could give it a go, please.
Well, I think it's really clear whether it's a community in the United States or in South America or in Africa, that community approach and building on the resiliency of the systems that exist is critical if we're going to have an impact, and especially a sustained impact. But the other kind of issue that really is clear and is reiterated all the time in all the presentations is that the data systems are critical, and they don't have to be perfect, but they have to be available to guide us in our action. And you use the best information that you have available, and you listen to all the voices. And that was really clear with Emily and Carly's presentation, that everybody has a voice and needs to be listened. And we have to search out the voices that are not clear and provide special areas, especially like for our youth. But when we do this kind of work, if we don't get the community leaders involved, if we don't get the key influentials in our society involved, if we don't get the policymakers at the government levels and the advocates involved, all of it can go to naught. So while you're doing the hard work on the ground, if we're not doing the work at that level, we can lose it. The other thing is to ensure some kind of funding stream to do it, because when are we going to be able to get the funding agencies not to see us as bleeding hearts, but people who have viable solutions that need real funding? We have all of the international agencies starting to, whether it's IADB or the World Bank or whatever, putting in violence as USAID, putting in violence, just like climate change, as a cross-cutting issue. Are we ensuring that the work is being guided by what we know is the best evidence? And how do we ensure for those who are not yet on board that it really is seen as a development issue, it's a human rights issue, that we ensure that, and that I think would help us a lot with the funding. For the region, for the Caribbean region ourselves, I don't know if Patrick and the Caribbean Public Health Association would like to maybe bring a forum member in April to Grenada, and we could do some work in a very pleasant environment to look and see how we can work at a regional level in a very manageable environment that is being destroyed by violence, because the whole region is dependent on tourism, and once you have violence, it destroys your tourist industry. I mean, I think we need to, but we're going to need people like Shelley, because most of the money right now is being spent on hard prevention through police control and army. How do we get the issues we're talking about into their arena, and how do we get them at the table as well as the development people?
I think you just took my next question, which I actually was going to pose to our colleagues from Yale, but Shelley, it's the idea of how can we advance the evidence to include what I call frontline workers, whatever that means within your discipline and within your work. And I do see we'll hear from some folks. So Shelley, and then if we could hear maybe from
I just wanted to
the
build on something Elizabeth said that tied to something I said earlier that ties to New Haven. And one of the concerns I have, and it rang through a lot of the presentations here the last day and a half, is that we use the data and we tend to measure our success in terms of absence of negatives. And that's getting old. In New Haven, I respect that crime may be down 3% in a neighborhood or 7% or 15%. But if people don't feel safe going to the convenience store to buy bread, who cares? And in so many of the things that we do, we're focusing on absence of negatives as the end product. And candidly, on the front line, as a police officer, that means nothing to me that crime's down 3%, because I know the department can manipulate data. As a citizen living in a neighborhood, I don't care that burglary's down 2%. I want to feel safe in my home and knowing that my kid is walking to school in a safe environment. So we need to begin to look at how we define our outcome and use our data differently.
I think, you couldn't have said it better, because I often think, and this is kind of wearing the hat as a physician, thinking about counseling a patient, and oftentimes, there's only so much the evidence says that you should take your cholesterol medication, you should do this and that, you're going to change, et cetera, lose 10 pounds, this is going to make, you have a lower risk of cardiovascular disease 10 years down the road. And that strategy just isn't working. I mean, I think we have so many examples in medicine, in public health, where by the imposition of interventions, albeit evidence-driven, albeit with reams of data, especially in the cardiovascular risk factors and disease world, exist, it doesn't translate to the types of lives that our patients want to live, to the types of communities that they want to inhabit. And so I think that there's nothing more powerful for me in thinking about how we bring those frontline individuals into the conversation of generating excellent, high-quality science than saying that that's the end outcome we want to achieve, right? So that, to me, the science in and of itself as an abstraction has no value if it doesn't move to create the communities, the patients, the lives that they want to live. And so insofar as possible, I think it's imperative, that in the forum here, that hopefully we're not the last time where there are community folks at the table talking about this. Hopefully that there are ways of learning about the types of interventions, the types of assets, the types of outcomes that community members want to see, community leaders, experts, legends want to see, that then shape kind of the work that we're doing as scientists and as policymakers.
There's one more thing that I'd like to add, and if you wouldn't mind putting up your slide again, Evelyn. Well, if that's difficult, it's all right. I just want to, at the very beginning, Jim highlighted this global status report on violence prevention. I'd like to bring this back to the global kind of view again. And he talked about, this is predictable, this is preventable, the importance of data. And I'm sure that we'll have one of our speakers in the audience talk a little bit about the National Crime and Victim Survey and the importance of making sure that we have data that can help support us and move us forward. But the thing I wanted to talk about is this social norms business, because I think that one of the things that we've brought up in some of the conversations is the marketing of firearm violence for entertainment. And whether it's in gaming or whether it's in the media or whether it's in movies, I think that when you live in the environment in which firearm violence is seen as a norm or as entertainment, it makes it hard, and it's an uphill fight in some ways to try to say, what is it that we want to live in? Because safety walking to school is wonderful, but if you're barraged every time you want to do something enjoyable with choices related to taking in violence, it is limiting. So I just want to call that out, I think, as one of the take-homes for me about how vital it is that the environment speak to health, and that we limit some of our toxic exposures in that way.
Thank you. To bring it out to the floor, and then we'll come back again, and I would like you to be thinking about, as we think about the way forward, the forum and how we might, what we might focus on next. What are some of the issues or concerns or ideas that you heard as an audience that might help inform the work of the forum? So you can be thinking about that, because we'll come back to that question. You start with Arturo.
Thank you. Just as a response to Sheldon's question regarding what's the picture that we are supposed to accomplish, I'd like to point out to a big white elephant inside of this room. And maybe we talked little about it, but I think it's implicit. And at least the way I see it, I think we're talking about the Universal Declaration of Human Rights and the Convention of the Rights of Children, basically. And we're talking correctly, as you mentioned, of well-being. And we are all aiming that every child, woman, adolescent, and adult has the full exercise of his most basic human rights. The right to life, to start with, to health, to dignity, to education, etc. So I think this is one of the, when I graduated from my PhD, we got aside our diploma, the Universal Declaration of Human Rights. And I think this is implicit in most of the work that public health workers are doing.
Thank you. Bartholomew? No, it's not. You're just holding up.
I don't have a name tag.
Please introduce yourself.
My name is Bahati Jacques. I am a policy analyst with the Africa Faith and Justice Network. The name tag is for my brother, Barthélemy, my colleague. I've been here since this morning. I wasn't here yesterday. Maybe you mentioned this. However, taking the example of New Haven and the mention of minorities, we are aware that there are many waves of African immigrants into this country, and many of them come from war-torn zones. And it has come to our attention as Africa Faith and Justice Network that sometimes there are behaviors that are happening in the families and the lives of these new immigrants. Not that these people are bad, but because of the trauma from home. And then the police are arresting them or going to their homes without an understanding of their background, the violence that they have experienced. So when we are talking about what do we take away, I wanted to suggest that maybe those who are practicing medicine, when you are seeing African immigrants, maybe ask them where they are coming from, learn about their home country, whether they have been exposed to violence, or a policeman, policewoman responding to domestic violence, learn whether where they have been. Maybe it's a reaction to the background, not that the family is dysfunctional, and look in the prisons. Many Sierra Leoneans, child soldiers who have been brought here, they are in jails in many prisons. So when you talk about interventions and violence, keeping in mind where some of our people come from. Thank you.
I think it's a critical connection to the idea of the means of violence, collective violence, and that we don't have to be in it in the moment to have it affect our lives and our communities. So, Roel, and then Lisbeth. Lisbeth, you're on. Thank you.
Ask about whether there isn't something of a gulf between Shelley Greenberg was saying and Dr. Wang was saying, and I think most of us here agree that we would like to measure our progress in terms of well-being, increased feelings of safety, and so on, rather than some of the negative stuff. And yet, those good things are harder to measure, and they are less convincing to a lot of our funders. And I wonder whether you, and especially our federal funders. How do we overcome, how do we cross this chasm? Because, you know, the people in this room, we're all agreed and we're right. And the people who are asking for something different, they're right in their terms, but we need to somehow bring those together in a way where we can ask to be measured by things that are more meaningful and better for the things we're trying to achieve.
How about a forum workshop called The Politics of Violence Prevention? Because what we teach to police leaders is that to be absolutely successful, you need to speak 3 languages fluently in today's age. And those languages are internal, external, and political. Politicians love the statistics. They run their campaigns based on reducing crime. Internally, we as police know that the data can be manipulated to show reductions in crime simply by how we classify reports, manipulate within the legal parameters of report manipulation. And again, to the community, I don't think anybody in the neighborhood's been made to feel safer based on statistical reductions. So we need to come together and talk about that. None of those perspectives is wrong. What we need internally in law enforcement, and I suspect in emergency medicine, what have you, is very different than what the politicians need in the way of outcomes to do what they need to do, and is very different than what people in neighborhoods need. There are common threads, but we do need to talk about the political realities of violence reduction. The funding, particularly the federal funding, is based on what the politicians think. At the moment, we're about to put $230 million into body cameras for police and police training, ill-defined, with no research at its base, based on political reaction to a couple of incidents. Serious incidents that warrant reaction, but the fields haven't come together to guide the response. It's being politically driven. So I don't mean to ramble, but I think we do need to come together and deal with put our heads together and say, how can we deal with the politics that drives our efforts toward violence reduction and do it in a positive way?
Just to add one more thing too, I think the other piece we're missing is the people that are actually causing the violence or having the violent or part of the acts themselves. I think Jerry will touch on that a little bit more, but just, you know, to bring the people from the community, I think we're, you know, the research could be there, the medical people could be there, the law people could be there, but the people in the community are who we have to learn from.
And one thing, if I can add very quickly to that, we've looked at curricula across different fields. What do they teach in schools of social work? What do they teach in police academies? We just did a study of curricula in 28 police academies. In none of them do we describe what the essential elements are to a successful neighborhood. Transit, access to small business, good schools, access to jobs, access to health care, safety. And if we could come together across professions on what we think makes a safe neighborhood, whether it's in New Haven or in Africa, with that common picture, I think we could go a long way in presenting positively what it is that we do.
Comment in the back table?
Oh,
Jerry.
okay. So, well, my name is Jerry. I'm from New Haven, Connecticut. And first of all, I'd like you to know, once upon a time, I was a product of the environment. You know, I was incarcerated maybe 25, 30 years ago. I'm still in the struggle. I overcame a lot. I'm a single father, raising till he be 10 years old tomorrow. I had him ever since he was 2. But at the end of the day, when I go back to New Haven, when I take off this tie, and go back into my hood, I'm still a black man. I'm not Jerry Smart. I'm still a black man. And that's frustrating to me. It's frustrating to my son. Regardless of all the work that I do in my community, regardless of how successful I try to be, I'm still that black man. You know, should I be intimidated by the cops? I'm a man. I pay taxes. I go to work. I go to school. I'm doing what a lot of y'all doing in here. I'm not no professor or whatever, but you know, I have goals also. So when we talk about a good neighborhood, um, I became a part of this team 4 years ago, and my vision was, how can I bring my community back together? What is my vision? You know, because I mean, it was so much violence going on in the neighborhood. And one thing my community do, we put so much emphasis on the police, we put so much emphasis on City Hall, we put so much emphasis on the politicians to bring this stuff together, just to put it back together, you know, bring restoration. And that's sad because they are not killing each other. They are not bringing guns into the neighborhood. So I say to myself, my vision is that if you sell drugs in my neighborhood, you're shooting people, you're robbing the women, you're hurting the kids, you can't come here no more. You know what I'm saying? I would like to see a neighborhood, my vision, when the kids can come outside and play, where the flowers are growing, where we have good schools. And like Dr. Sheldon said, when I could go to the store, you know, when I go to school, I have to put on that intimidating mask, you know, because I mean, it's like that. It is like, you know, me against the world going into my same neighborhood. So this is what I face as a black man. It's reality. Like I said, when I take off this tie, when I get to New Haven, it's like on and popping. I'm just back in the neighborhood, you know. So I love the work. I'm going to continue doing this work. It's hard work because you're facing so many obstacles, not only with the mass, but with my people also. That's it.
Thank you, Jerry. And
Mhm.
you spoke, you know, I'm looking at the strategies to reduce violence, and while the World Health Organization specifically calls out promoting gender equality, um, this nation and many have roots in racism and sexism, growing into homophobia, that equality and lack of equality can be used as a means of violence and can hold up ways in which to do intimidation and violence and trauma. So thank you for naming that, because I think it's something that we haven't done very well at naming in this day and a half. I'd like to, I think, go to Bartholomew, who's now the ambassador. Thank you.
Oh, yes, of course, I'm the ambassador of Africa. Just my vision for the continent of Africa, and I was very happy that we could bring in the African perspective into the debate, which in many ways bears with culture and how to transform that. I wish to dream that the scope of this reflection that we've done here may be extended to the continent of Africa, that the experience, success stories in this country could be extended to the continent of Africa. How is a challenge that I'm throwing to the audience. How are you going the years to come to bring the picture of Africa into the debate and be able to learn from Africa and also to offer to the continent of Africa? Thank you.
I want to return to the question of vision. This idea of moving towards something positive with purpose is something that is very real in our work. We, within our own team and our own steering committee, and we're on the streets and we're looking at our data, we really are moving towards a positive vision. And we actually have moments of sort of relief where we describe what that is. And there's a different sort of countenance that comes upon us when we do that, and that fortifies us. And then it challenges us then to think about how it is that we want to measure that and how it is that we want to move towards that. And in our work as physicians, we were raised within a system that taught us to work towards absence of disease. And in fact, our work here in New Haven, and then also sort of as we connect with a network of folks who are dissatisfied with that and move more towards the WHO model of really understanding that what we need to strive for rather is a sense of well-being and a positive state of health, not that one that is simply defined by the absence of disease. And that drives us, and that is part of the vision that we have for the work that we have and the kinds of neighborhoods that we want to build so that individuals living within them can attain thriving lives in which they see the greatest amount of well-being. With that, I wonder, rather than sitting here at a table discussing the prevention of violence, should we be talking about the promotion of peace? And even just that change in our language may have changed the kinds of questions we asked and the kinds of ways we went about getting to the answers that we're coming to. And to that end, we're also connecting with other folks who are similarly dissatisfied and who are trying to develop the measures that we need in order to add rigorous research to this positive frame in which we want to move. And so, yes, we're measuring things like social cohesion and collective efficacy, these positive health assets, but we're actively also trying to design measures and validate measures to look at community resilience. And they exist. They're just not being used widely. There's also several measures that exist in the world for well-being, and these are multidimensional constructs of health that incorporate social, emotional, financial health, not simply physical health, and it sets it in a very positive frame and values what is the life evaluation that one has for one's own experience in life. And so that work is being done, and I think that there is a sense of impatience with that. And I think we should continue to ask the question, what is the vision? What is our purpose? What brings us to this table? What is it really?
I also just wanted to follow up on the vision for doing work and connecting in Africa. And I just would like to maybe put Patrick on the spot for a moment. If as we think about the future and the next steps for the forum here, which will be my question I'm putting out to the room, if you could maybe talk a little about very briefly about the work that was with the Africans Academy of Science and so our
Sure. I didn't plant this question, but I'm happy it came about. In addition to directing the Board on Global Health for the last 10 years, I've also directed the Board on African Science Academy Development. We received about 10 years ago now a $20 million grant from the Gates Foundation to help science academies in Africa do basically what we've been doing here the last day and a half, to create a platform in their nations that focused on evidence-based approaches to policy making around an array of issues where science can make a difference. And the program is actually coming to a formal end in February, but we continue to plan on doing joint workshops and things like that. Now, some of you know that the workshop immediately prior to this one was a workshop in Uganda in partnership with the Ugandan National Academy of Science on the subject of preventing violence against women in East Africa. And we're very well positioned to do this kind of thing. We have recently provided some of our grant money to the South African Academy to undertake a study on the science of homosexuality. As some of you know, there have been the passage of rather draconian laws in Africa, and some of these laws were based on, or at least justified by, very flawed science. We wanted to help the scientific community of Africa mobilize within their cultural context the scientific information that would put the issues in the proper perspective. And so the South African Academy has been working on that study with some support from us now, and will release it. They also are doing it in partnership with people from the Ugandan Academy and the Nigerian Academy, and they'll be releasing it in, I think, in January. So I guess the bottom line is we, in this forum, want to be very global. That's why global is in the name. We not only convene inside the Beltway, but we have the capacity to convene around the world. We are and particularly in a strong position to work with people in African countries. And for those of you who want to know more, I have a brochure that we've produced that highlights a lot of the work that the African countries are quite capable of doing independently, but also work that we have, projects we've done together, because sometimes we can learn a lot from each other. So independence is not always a virtue. Does that address what you were interested in?
I think that was incredibly helpful. Yes, thank you very much. You know, for those of you who don't have a name tag in front of you, yours or someone else's, and want to engage in the next part of this, please feel free to go to the microphones. Yes. Oh, okay. Thank you. I am. Apologies.
It's all right. Thanks. First, I want to just thank the forum for a really terrific 2 days. I know I learned a lot. I want to make 2 points. First, to pick up on something that Bridget said earlier around the need to develop better data systems, which I think is a theme that we've heard throughout the 2 days. And just to return to something that Jim Mercy talked about yesterday, the National Violent Death Reporting System, which is a CDC program to create a national surveillance system on all violent deaths in this country. It's a tremendous system. It has been expanding, but it is still not a nationwide system. And with an increase in funding this year, the CDC was able to expand the system to 32 states, but they've still got a ways to go before that system is truly nationwide. If you want to learn more about the system and about how you can get involved in efforts to promote NVDRS, there is a coalition that's been formed called the National Violence Prevention Network. It's chaired by the American College on Preventive Medicine, and they have a website which is preventviolence.net. I encourage you to check it out. You'll learn more about the NVDRS program and how you can get involved in efforts to truly make that a nationwide system. The second point I want to make is, I think we've talked a lot about research and data, a lot about the importance of community engagement in violence prevention, but I want to make sure that we don't lose the importance of policy and engagement on policy. And this is a point that Elizabeth made earlier. And we heard yesterday, I think, a lot of compelling presentations about what the evidence tells us about policies that can have an impact at reducing violence, from the gun violence restraining order that Shannon talked about to some of the other policies to reduce youth access that Daniel Webster talked about. But maybe one really immediate example. Bridget, you talked about one thing that you want to do is to go back in your practice and counsel parents about the dangers of firearms in the home and the risks of unsecured firearms in the home. There is an effort now underway at the state level in this country to prohibit physicians from having those conversations with their patients. This passed in Florida. It's actually been upheld by the courts, that Florida law, and it's subsequently passed in Missouri, and there are efforts to bring these laws to other parts of the country. So it's incredibly important, I think, for the work that all of us do, whether you're a physician or working at the community level or in research, policy affects the work that we all do. And so I think it's critically important that we all not assume that somebody else is going to deal with the policy, because it really, crosses across all of our efforts. And I think it's really important that we're all engaged in those conversations as well. My other big takeaway from this forum was how important it is to get out of our silos and to learn about the work that, many of us are doing around violence prevention and look for ways to integrate those efforts. And I think this is another good example of that.
Thank you so very much. I would like us to just take this next bit of time for us to think about where should we go next as a forum. Forum members had this conversation on Wednesday, so it's not new to us, but we'd like to hear from others as well. And please go to a microphone if you'd like to speak, and if you have a card in front of you and want to share some ideas. I'd like to actually start, see if folks on the panel have anything that they'd like to add of where we might go next, or other thoughts, and then we'll work.
I think one of the topics that came up among the IOM committee was the issue of children and looking at adverse childhood experiences, toxic stress. What are the new information that has come forward in terms of the impact on neurodevelopment and physiology, and also in the area of resilience and protective factors? So I think that's one topic that we certainly have heard a number of people talk about as a future workshop potentially.
Yes, this is coming through, okay. I'm Dr. Betty Lee Davis, and I'm a clinical social worker, and I've practiced in the behavioral health services for many years with children, adolescents, families, and adults. And most recently, I've become interested in trauma and the impact of violence in communities permeated by violence, as well as children in the school setting. And I think this is the fourth of the workshops I've attended here. One of them was bullying. The other three have been the global violence. And what I would be interested in hearing, what are seeing added and what appears to be missing from the looking at violence, is the role of trauma and violence, and the role and untreated trauma, untreated PTSD as a means of transmission of violence for those who are either in the behavioral health field or aware of it. Behavioral reenactments is one of the effects of violence on children. Hyperarousal, flashbacks are also effects of violence, and the Veterans Administration has established and well documented that, and protects veterans coming back from war from the effects of post-traumatic stress disorder, which can lead to shooting sprees or suicide. And that's, in my view, happening in communities that are permeated by violence. So that, in particularly in communities where there are guns flowing on the street, and there's an interplay, whether it's considered an interrelationship or interdependence, in my view, between violence and weapons and post-traumatic stress disorder. And I would be interested as a guest in having an opportunity to attend a workshop and to hear from people around the country and around the globe looking at this issue of trauma, untreated trauma, as also a means of transmission of violence, or part of the way that violence spreads.
Thank you, Betty. I really appreciate that. We had a brief conversation at lunch, so I was hoping you would share. That also connects to our colleagues' comment about the impact of war and trauma. So may I move to you next, because I think your card is up? Yes.
Thank you. Before I go to answering the question, where do we go from here? I wanted to share the fact that from the example of the New Haven, my experience coming here, I saw more that we live on top of each other in these skyscrapers. And it's difficult to even know the person who lives on top of your apartment. And how do we build communities and those, social cohesion when you live on a property that belongs to somebody else? The apartment owners, they have laws and the regulations. If you want to hold maybe a community meeting, maybe you need to go through those channels. I had the experience of owning a home and living in an apartment. Those are two different dynamics. So I just wanted to put that out there because previously when these skyscrapers weren't out there, we lived on the same level. You could go outside, I see you, and when I owned the home, I knew most of my neighbors. When in an apartment, no. In any case, where do we go from here? As far as Africa is concerned, we have identified the democratic process as an important element to reducing violence on the African continent. As more self-perpetuating leaders continue to hold on power, we have seen the increase of violence in many countries. Also, we have seen that the Balkanization of Africa, the way they divided nations, continue to cause some violence on the continent. But we have identified that strengthening regional bodies integrates more the people whose identities and cultures have been broken down by the colonial powers. So those could be structures that can help mitigate some of this violence. And finally, responsible investment. Wealthy people, previously was state going to Africa, making Africa the place for resources, whether human or natural. But now it's wealthy companies and individuals going there to invest, no matter the cost on humans and anything. But we, as Africa Faith and Justice Network, have been advocating for responsible investment. Section 1502 of the Dodd-Frank law, the Financial Reform and Consumer Protection Act, speaks to our efforts and other organizations, whereas companies are required to report publicly that the end product in our phones and refrigerators, our planes and whatever, those who make them, do not contain minerals coming from Democratic Republic of Congo and neighboring countries, whereas millions of people died. So those people were investing, practically giving money to rebel groups, outsourcing minerals from them. How do you believe that violence will stop when they have even funding from anybody and everywhere? We included buying these nice cell phones and cameras and everything. So responsible investment, also responsible purchasing. Ask if your cell phone is conflict-free, if your computer is conflict-free, and so on. Thank you.
Thank you very much. That was a really amazing example of overviews of interconnection issues. I think somebody on that table, I can't see your name. Do you have a name tag up?
I'm the not Bridget. My name is Nancy Hart from the University of Florida College of Medicine, and I have a couple of outlandish suggestions on the way forward. And one is, why don't we have somebody here from the National Rifle Association? Because I think politically and policy-wise, things are not going to go forward. They're going to go backwards at a very rapid pace over the next few years. And let's share what we know with them and have them share what they know with us, and try to create a little transparency on what's really going on, because I'm not really sure what's going on when a crazy thing can happen, like doctors not being allowed to ask patients about guns in their home. Come on. What does that mean? And as to the whole notion of policy and politics, don't forget that everything is local. And if we're frustrated with what's happening at the federal level, let's talk to more people about what's happening at the local level. And I think we've heard from Yale New Haven. They're going to have a progress report for us in a year or so. And there are other communities that have been doing this work even longer than they have that might be able to bring some lessons learned. And I mentioned earlier, why didn't we have anyone from Canada, our neighbor to the north, talking about the flow of guns into Canada and what's going on there? Their child policies are very different than ours, and I think their communities may be way ahead of us, and we probably have something really important we could learn from Canadians.
I just wanted to note, if you were here yesterday, I guess, when I opened the meeting, I shared a report that we released last June, June of last year, on priorities for firearm-related research. It was funded by the CDC Foundation and the CDC. And we did very much involve the NRA in that report. There were several members of the NRA on the committee. We had the head of research for the NRA as one of the presenters, and then I think it was the former head of research for the NRA as one of the peer reviewers. And I think in line with what you're saying, it was very, very helpful to involve the full spectrum of folks in the process. And I think we ended up with the result that we did, which I think has been a very helpful result because of that full degree of involvement.
Thank you, Patrick. And just checking in if Michelle wants to add, we're talking about the way forward and informing the forum, and time for a couple more thoughts, and I think Shelley wanted to add something.
I appreciate that because I have to, forgive me, I have to leave in a few minutes to catch a train. But two quick things. One, we've invited gun advocates from the NRA and other organizations to many meetings. My dismay, and I was actually sharing it with Steve, is that we need to tell them to send people who are open-minded to listening and engaging in positive dialogue. The last session we had, there's new rhetoric on the street about this. The person that showed up representing an organization, not the NRA, but another advocacy organization, got off on this bizarre conversation about if guns kill people, do pencils create spelling errors? I said, what? And he got into, people kill people, not guns. It was bizarre. They sent the wrong person. And I've been to too many meetings where we've run into folks like that. So as long as we can say to them, send someone who wants to participate and make life better for people, great. So I just want to make that point. The other thing as we move forward, I touched on this just briefly, but I think we really need to focus on, and I can't say whether it should be an entire workshop, I would like it to be, we need to focus on fear and people's fear. It inhibits them from coming forward, individually and collectively. I don't know if you saw the 6 o'clock news here just yesterday, that the mayor said in regard to shootings, this was Baltimore, we can't do it alone, we need people to come forward to address homicide. Well, no. I'm not going to come forward to address homicide. I'm just a citizen. That's what we pay the police to do. Now, you show me that you're successful, and I'll join in. But don't put me on the front line first. So we need to talk about fear and how fear is affected by people's environment, their experience, their values, their relationships, and what we can do to better manage people's fear so that they're more willing to engage fully in what it is we need them to do to make their neighborhoods and communities better. And take on those leaders, formal and informal, that want to cause them harm. Thank you.
Thank you.
I apologize because I had a call, and so I really am walking into the middle of a conversation. I'm not even sure what it is.
I just wanted to, we're ending the day before Fran closes out the workshop of the way forward, and is there anything in these 2 days that bubbles up as in what next for the forum?
Right. So for me, I think overall I had kind of two thoughts. One is that, I mean, I am very interested in what does it take to create an activist community that's going to actually respond to this issue locally and say, we are not going to take this anymore. This is not the world that we want to live in. And I was very happy that we had the experience from Yale because I feel as though that's, you know, a part of that. But I think there are more positive deviant communities like that. And I would like us to learn a lot more about how do we ignite local community reaction to prevent violence in their own spaces as opposed to externally driven. So that's one thing. The second is that I learned a lot about guns that I didn't ever know before. I'm not sure I wanted to know. I'm perfectly transparent. I walked into this meeting deeply against guns, feel like they should be banned. I don't care about the Second Amendment. I feel like it's anachronistic. And I am very disappointed that as a community, we're not doing a better job with the evidence that we know, and particularly to take it on. And I feel like as long as people are scared of the NRA and are not willing to really look at what the science says, we'll never get anywhere. But that being said, understanding the space of what this meeting was about, I learned a great deal. And I felt, again, and I talked about this a bit yesterday or the day before, I still feel like we haven't figured out the communication piece. We had a great session, a forum on new technologies, but I still feel, and it goes back into this community mobilization and activism piece, how do we get, as I left right when you were saying very articulately that I really appreciated that now you're going to ask every, you know, person, you know, are your kids around guns? How are you keeping them safe? You know, aren't there 4 or 5 messages that we could say to the world that if you are choosing gun ownership, these are the 4 things you must do to protect your children in your community. And I hope we could talk a little bit more about communications and messaging. Thank you.
To honor our time, I want to thank everybody for the conversation. And if you have more ideas or how else we might move forward as a forum, forum members who are in the room, if you could raise your hand, please, and folks can connect with you directly. That would be great. So I again went back to the report from the World Health Organization and looked at what their way forward is. They stole our term for their report and captured some of the areas that, amazingly, without even really looking at the report, we covered in this past day and a half. To strengthen the global prevention agenda, to increase collaboration, whether it be between organizations, donor agencies, multidisciplinary, in our own communities. To set baseline and targets and track progress. They came up in different ways, different language, but really, where are we, where do we want to go, and have we gotten there? What more do we need to do? Implement and enact policies and laws that are relevant to the multiple types and forms of violence that we discussed, and those that we didn't have time or didn't get to on this day and a half. Strengthening mechanisms for leadership. This includes coordination and collaboration, and we talked about that in different ways, whether it's at the community, within the community, across sectors, but building that leadership to build the capacity. And integrate violence prevention into other health platforms. And when I think of health, mental health, a holistic view of how do we integrate violence prevention across the areas in which we work and live. So I think that we touched on a lot of information this day and a half. We have a lot of food for thought. And I'd like to thank our panel, the Way Forward panel, very much for your time. And you're welcome to stay here or go back as we invite Fran up to do a closing message for us.